A tear descends down my cheek, feeling in my lower chest, that feeling you get before you're gonna have a good cry. I stop, I take a breath, I rub the tears from my eyes. I return my attention to the computer screen in front of me. Her words, they hit me at such a visceral level. I am there, I am present. I want to help him. I want to help her help him. Over the last 15 years, I've read more than 1,500 personal statements from students and practicing general dentists who are applying to be in my residency program for pediatric dentistry. And this is the first and the only time that I've ever cried reading an application. So what was it about this personal statement that resonated with me so deeply? I knew what it was right away. Her experiences with him on that day would forever change the future of her professional life. She would now become a pediatric dentist, and she would care for children with special healthcare needs. These are children who have advanced medical needs. They require specialized procedures. They require adapted healthcare environments to make sure that we keep them safe and we optimize their care. So yes, experiences, they show us what to expect. They show us how to act, and they give us the confidence to try again and again. Experiences, they change our perspective. Experiences, they guide our decisions. Experiences shape our lives, and they influence our identity. Experiences are powerful. I myself, I'm a father, I'm a husband, I'm a teacher, I'm a pediatric dentist, and I'm a clinical scholar. Since 2004, I've worked every day to make sure that a culture of health is available for children with special healthcare needs. I've given countless lectures. I've recounted my experiences in caring for thousands of children, both in clinic and hospital settings. I've advocated for resources and policy change with decision makers in education, social services, healthcare financing, and in the government. Yet every day in my clinic, I meet a new child with special healthcare needs. And my team and I, we work to address their dental pain and other oral health problems that they're having. The system, it just isn't working. Unsurprisingly, dental care remains the second most common unmet health need for these children. For a long time, I believed that education was the first step in addressing these disparities and this wicked problem. I really believed that we could build a larger workforce strictly through education. I was wrong. Education is certainly important, but personal experiences with children who have special healthcare needs, it's simply life-changing. Over the last 3 years, my colleagues and I have mobilized an interprofessional learning community. We have gathered specialists and experts, students and doctors, dentists and nurses. We've also advocated with family advocates and therapists and so many others. We've shared resources and our knowledge with each other. We've talked about best practices for caring for these patients. And our group meetings provided lots of value. But most important of all, we introduced our learners to parents and to caregivers of children with special healthcare needs. These parents, they shared personal, honest accounts. Sometimes these accounts were very heartbreaking accounts of their child's experiences in healthcare settings like clinics and hospitals. So we've worked to bring our learners into a situation where they can learn from these children and these families outside of healthcare situations. They've gone to their homes. They've sat at their kitchen tables. They've learned about these children as people and not just as patients. They've learned to see their strengths instead of dwelling on their limitations or their weaknesses. And we have seen firsthand how these experiences, they've changed, they've inspired, and they've motivated our learners. They are ready to try. They want to care for children with special healthcare needs. Through our work, my colleagues and I have recognized three important truths. The first truth, healthcare providers must include parents and caregivers in the care of their children. Parents, they're the most important, most commonly involved health-related caregiver for their child. We need to listen to them. We need to troubleshoot with them. We need to empower them as equal members of the healthcare team. Second, healthcare providers need support and mentorship when starting to care for children with special healthcare needs. Seeking help, continuing education, and mentorship, it's not a sign of failure or of a weakness. It truly is the hallmark feature of a professional and a lifelong learner. And third, immersive experiences with children who have special healthcare needs, it heightens awareness and it instills commitment in engaged learners. So today, I ask each of you and everyone else to take action with us. Welcome students and new clinicians into your world. Have them observe and experience your life touched by children with special healthcare needs. Whether that be in healthcare settings, in schools, residential facilities, community organizations, or even in your own home. Encourage them to meet with colleagues and friends and family members who might also be really good mentors for them. Help them to understand each child's individual needs. Encourage them to talk more frequently and better with other healthcare providers. Encourage them to be generous with providing constructive feedback about how healthcare appointments have gone and what we can do better to make the next experience a more richer and more personal experience. And in the wise words of Benjamin Franklin, tell me and I forget. Teach me and I may remember. Involve me and I learn.